Bill Parisi here, founder of the Parisi Speed School. I am with Dr. Tim Lyer of Atlantic Sports Health from Atlantic Health Systems. And today we're going to talk about the ACL in the pediatric athlete. And it's so important, as we were discussing earlier, to make sure you go and see a pediatric sports medicine physician, especially when some of these injuries come about. So, Tim, talk to us about the ACL and what happens when these younger kids are hit with this devastating injury.
You're totally right, Bill. It is devastating because this can be sometimes even a career-ending injury because there's a traumatic force going through the knee with a lot of other injuries associated with the ACL. You're bringing up a good point, and it's very important to see a specialist trained in taking care of young athletes.
Yes.
The problem we have with the ACL, and a lot of our athletes and parents are fairly aware of this now, is that the ligament itself ruptures inside the knee and prevents the protective structure of that ligament. The problem with younger athletes we see is that they are still having open growth plates. And we have to consider this anatomy when we're treating these athletes. Unfortunately, an ACL injury in the vast majority of cases is associated with surgery. This ligament, other than many other structures in the body, are not healing itself. And having a young athlete, specifically with a lot of pivoting activity, soccer, basketball, will not be able to continue on the same level if you are not having a functional ACL. So as much as we try in sports medicine, specifically preventing any surgery, of course, this injury usually needs and requires a surgical solution. Now, you're dealing in a pediatric population with the growth plates, as we said earlier. And the growth plate is a structure which is, number one, a weaker link in the bone. Number two is the area where the bone grows from. The traditional ACL reconstruction drills when we put the graft inside the knee during surgery through that area of the growth plate. And you can that way injure and sometimes even completely destroy the growth plate. So if you're talking about an athlete 11, 12 who has a substantial amount of growth left and you injuring that growth plate, he will have alignment problems, he will have growth problems, he will have long-term consequences. So that is the reason why it's so important to have someone look after your child and young athletes with this injury who is trained in that population.
Yeah, that's so important. You know, do you see a lot of young kids that tear ACLs at 11, 12 years old?
11, not so many, quite frankly. Luckily, we do see a big increase around the age of 12 and a half, 13 and a half, up to all the way to the adolescent and then late, early adulthood. The problem is, of course, that, as we know, very often this is a non-contact injury. So these injuries will happen. Fortunately, we have great programs in the system now, great programs throughout the country which really help preventing these injuries with a lot of functional treatment, things like you do at Parisi, things we do with physical therapy. So we see a high incidence of these injuries, but my goal and my hope for the future is that we can prevent these injuries from happening further.
Yeah. Well, that's great insight in terms of just making sure you see a pediatric sports medicine specialist. Really good. Tim, thanks so much. This info is really insightful, and I know our parents are benefiting greatly from it.